Hey everybody, good afternoon and welcome to week 2 of the Retention Academy Planning and Strategies Behavioral Health Edition. I'm Suzanne Spear. I am the Director of Workforce Development here at ACU, and we are just so excited that you guys are back. You made it through the first week last week and you decided to come back for more. So we're really excited to have you. So I've decided to follow in Allison's footsteps and do something a little bit more fun than just a normal picture today, and put my Bitmoji up there. And even though it's not animated or isn't doing anything fun, I thought it was a little bit different and might make y'all smile and just something a little bit more unexpected. And again, if you weren't sure what you signed up for or who you signed up for it with, we are the Association of Clinicians for the Underserved. We focus on helping to recruit and retain clinicians into underserved areas by various means, and through the recruitment and retention of clinicians, we seek to improve the health of the America's underserved populations. And we also have one of the things that ACU does is we have a national cooperative agreement. There are 20 national cooperative agreements out there and 2 that are focused on recruitment and retention. One is Community Health Center, Inc., and they're focused on pipeline development and team-based care. And then the other one that we hold is for recruitment and retention. So you can find all things recruitment and retention for clinicians on our NCA website, which we call, our NCA is called the STAR Center, which is Solutions, Training, and Assistance for Recruitment and Retention. So if you hop on over to chcworkforce.org, like some of you did and have done already, you can just check out all of our tools and resources there and take a look and peruse and get some ideas and hopefully find some things that are useful over there. And just to go through who our faculty is on this learning collaborative. So Allison shared last week. She is our VP of Training and Programs at ACU. Mariah Blake, she makes it all happen. She is always on the line, and if you have any technical difficulties during our broadcast, feel free to send her an email and she will get you straight. Ann Hogan is also with us, and she will be sharing next week on our series, and also myself. So we are the Retention Academy Dream Team here, so feel free to contact us at any time should you have any questions. Just a few housekeeping items before we dive deep into the world of retention. So we are recording, and make sure that you check out the discussion board where we'll post the recording in case you want to go back and re-listen to anything that was said during this week, and check that out there. Feel free to ask questions as we go along. You can either put it in the chat or questions box, and we will make sure that we attend to your question, whether it's here, or we should have plenty of time at the end to go through those questions. Or also you can ask questions on the discussion board if you think of it after the webinar. And also, while we're at it, let's just have a little fun. Why don't we? Because life is just too boring without some fun. So again, feel free to ask questions, either raise your hand or put it in the chat or questions box, and we'll make sure that we get it answered one way or the other. And again, feel free to contact Mariah should you be having any technical difficulties. So, the world of retention, planning, and strategies. We dipped our toe in last week, and we're going to continue doing that again this week. We're going to go do a little bit of deeper dive into the planning section, the second of the 3 parts of the planning before we go into the 3 parts of the strategies in the series. So, when we think about retention, you really have some planning that goes into it. And in that planning, you have those strategies that you want to implement. And hopefully, between those 2 things, you will have a great retention plan and strategies to increase the tenure of your staff and to really build a great team there that you have at your health centers. So this specific learning collaborative is focused more on behavioral health staff and all of those that are listed there. As Allison mentioned last week, there are tons of behavioral health staff that health centers have in their employ, and there could be many others that you might employ and utilize as a part of your team. And whether or not it's for behavioral staff or just frankly any other staff, but obviously we are really focusing on behavioral health staff here in this learning collaborative. But all the strategies that we are talking about here can be applied to any of these behavioral health staffers or any of the others that you might employ. And as we talk about things and we focus on our planning and our strategies, we have some tools at our disposal. So we are going to be using webinars like we are here and you're listening to today. We are also going to be going on our discussion board. So we only had like 2 people on our discussion board this week. And I would really, really recommend that you guys plug in and get on that discussion board. If you don't, for any reason, have the login information there, feel free to, again, email Mariah. She's got it for you. She can resend it, resend it or reset your login information if you need to. I think that you'll really find that when you finish this series with us, if you have engaged on the discussion board, in addition to listening to these webinars and participating on the webinars, you will get so much more out of the series, and you'll feel like that you really have some tools and some resources to take back and implement at your health center. So again, please just log in on that. It's not going to take a ton of time, but engaging on that is really going to make a difference as far as what you guys get out of it and what you feel, and just your overall feeling of the experience at the end. So Allison talked about last week some of the goals of this series, really taking your retention plans to the next level. And, as you all shared last week in the poll, a lot of you don't really have a retention plan. So, taking it to the next level, or frankly, just getting it started, and starting through that retention plan, focus on some specific strategies that you feel like you can really take and implement at your health center and really make a difference. And just some, even if it's a small strategy and some little steps that you can do to implement at your health center. And also, again, connecting you with others. So as I mentioned in the previous slide, please, I can't tell you how much that is going to mean to you and your overall experience as you ask questions and you look at you look at the discussion board and you hear what others are doing. It's really going to make a difference as you feel that what you're getting out of the series. So just to do a quick review of last week. So we talked about the retention planning process, what that means overall, and how that fits into your overall planning and your HR strategies. Allison also talks a lot about data. And I know data can feel boring sometimes, but when you really wrap your head around it, and when you, again, using the dipping your toe in analogy, once you start dipping your toe in, it's not as overwhelming as it can seem. And it's not as boring as it seems, I promise. So, whether it's, organizational data, HR data, or partner data, she really talked about how you can utilize that in the overall retention planning process and how you can make that, you can really see what's going on in your world and, from an HR's perspective, your overall organization, and then also what's going on at other people's organizations with that partner data. So talking about that. She also talked about the plan, do, study, and act cycle, and how that can really be a part of your overall process, tracking what you're doing, how it's going, and then maybe, realigning as things need to be realigned. Because, especially if this is something that you're really just starting to get into, it's probably something that you're going to need to zhuzh, if you will, a little bit, and really figure out your sweet spot. So, and that takes a little time, and it might take a few cycles of planning, doing, and studying before it feels right, and before it really gets to be something that feels and really gets to be in that sweet spot there. Okay, so we talked about where we have been, and we're going to talk about today right now. So today we're going to discuss some retention plans and sort of dive into that process a little bit more. We're going to be talking about and identifying the elements of a retention plan. Recruitment and retention go along together. So, talking about them interchangeably. I know we're focusing specifically on retention here, but if I slip up, it's because, really things can go either way and have effect on one another. So identifying the elements of a retention plan, and also we're going to be talking about how the elements of a retention plan can, you guess it, lead to increased retention at your health center. So, we know that's the goal, is increased retention, and we're going to talk about how those things all of these elements can lead to increased retention. So, when we talk about this, when we talk about planning and having a written, documented retention plan, why do that? So what can a written retention plan do for you? Well, number one, it can increase your retention. Obviously, that's the goal here, and that's really the number one thing that it can do. It can also build your organizational culture. So by having everything written down and processes that are in place, it can build your organizational culture. So what I mean by that is that it can make your overall, your culture feel cohesive, that there is, that it doesn't feel like it's piecemeal together, that it is organized, that there are strategies in place that feel like they belong together. And through that, your culture and the things that you're doing and the way that your employees feel, and also prospective employees feel, that you really have it together at your health center and things are really going well, and it feels genuine, and it feels good to the people that are working with you there at your health center. It's also going to provide consistency. Again, whether we're talking specifically about behavioral health providers here in this learning collaborative, but really it's going to provide consistency through all parts of your health center, all parts of your, all types of providers that you have, and, provide a place where each one of these processes are consistent across your health center. It's also going to decrease your recruitment costs because you're ultimately going to increase your retention. And it's it's going to save your organization money, and everybody loves to hear that. Especially when it comes to leadership, if you go through all this time and really are being intentional about it, especially leadership sometimes has to be convinced of this. And if they do, then go over to our resource center and you can find our financial assistance tool. I've linked it there, and you can put in all of your recruitment costs and see exactly what turnover costs you. And so, by putting those hard numbers in, you can see exactly how much money you're saving your organization. And then, if you're having a hard time getting buy-in from your leadership, then you can just say, hey, this is exactly how much money we're going to save by decreasing our turnover. And, whether or not it's leadership or just anybody else in your organization, everybody loves it when you're saving money. They love to see exactly how the return on investment of all these efforts and retention planning has on the overall bottom line. And it really does make a difference. So if you haven't checked that out, I would definitely check that out when you guys have a chance there on our resource center on our website. Okay, So when we talk about components of a retention plan, these are some that we're going to talk about today that can really, we're breaking it down and how you are going to focus on specific areas of your retention plan and how they can affect your tenure rates and your overall retention plan. So we're going to be talking about mission, compensation, benefits. Compensation and benefits kind of go together, work schedules, and also career paths. And these are all we're going to talk about how each one of these, again, fits into the retention plan and how they can, again, build that organizational culture and really build that, that culture of retention at your health center. Okay, so it's time for our first poll. And poll number 1. So if you're not awake and you've gone to sleep in the first 15 minutes or so, we're going to wake you up. And so just curious to know if you guys have defined elements in your retention plan. A is yes, of course. B, no, not really. We don't really have, elements in our retention plan that we could really point to. And then C, plan? What's that? We don't have one. So I'm going to leave it open for a few minutes. And I am going to, once it's done there, we're going to leave it open for just a few more seconds. And then, okay, the poll is closed. Okay, no, 50% of you don't really have a parts of your retention plan, and it looks like 40% of you don't really have a retention plan in place. So we're going to be talking about retention plans in general and some of the components of them, and then also the elements. So whether or not wherever you are in having a retention plan, hopefully you'll get something out of this today. So thanks so much for participating in that. Okay. Okay. Sorry about this, having a few technical difficulties. Okay, groovy. Now we're in the big time. Okay. So mission is the first element that we're going to talk about today. And so as we talk about this, we're going to think about mission as it relates to these 3 topics. So, mission isn't just something that you put up on your, on your website or have it posted in your waiting room or even in your break room. Something that is really should be overall, and I keep talking about culture a lot and using that that buzzword today, but it really should be a part of your overall culture. And we're going to talk about how you weave it into all of these sections of your overall retention process. So as I mentioned earlier, recruitment and also recruitment really is a vital part of retention. So when you're thinking about weaving mission into recruitment, which is, yes, a part of your retention plan, think about the unconventional ways to both source and interview candidates. So you're going to want to find, you're looking for, again, mission is a huge thing when it comes to federally qualified health centers or lookalikes for that matter. You want to find people who are mission driven, who really want to help people. And when people get into medicine and, specifically behavioral health, they want to help people. They want to make a difference in people's lives. They want really have a positive impact on the people that are sitting in their, not only in the waiting rooms, but also in their treatment rooms every single day. So, really finding those people that have mission or, are mission driven at their core is important. So, this again goes all the way back to recruitment. So think about places that you can source candidates that, that might be, different than social media. It might be different than LinkedIn or any other conventional sourcing methods. Think about listing things on websites such as the National Health Service Corps website. That's a great place to advertise. And if you're not advertising there and you have a qualifying HPSA score, please do so. That's going to be a great place to find people that are mission driven and are really focused on serving people in underserved areas. Also, when it comes to recruiting people, think about the interview questions that you're going to utilize in your recruitment process. These can weed out the folks that are not in it for the mission and overall increase your retention. So, think about those questions. Think about the interaction that your existing providers have with them. So if you already have a robust behavioral health team and it is, that this person is just going to be adding to it, make sure that your behavioral health director and also some of your other behavioral health providers meet with the potential candidate as a part of the interview process. When you bring them to talk to you and, have that on-site interview, make sure that you are, putting them and giving them a chance to really show you what their true colors are. And I know that, people can surprise us, but, be really attuned to what they're like during the interview process, because if you are paying attention to that and really listening to your gut during the recruitment process, it's going to help you in the long run retain them. Because if you get somebody who is just, just frankly just needs a job and they don't really care about the mission, this is going to be a problem. So make sure you're paying attention to that and are really looking at it when it comes to recruitment. Because if you pay attention during to the mission during your recruitment process, I promise you it's gonna really have an impact on your retention. Okay, so you have interviewed candidates, now you've hired them, and now you're onboarding them. So, your onboarding process is one of the most vital processes when it comes to retaining folks. It is your first impression. Obviously, yes, they've got your first impression when it comes to interviewing, but their first, let's say, anywhere from 60 to 90, even to 365 days at your health center is going to be crucial to having them succeed long term when it comes to actually retaining them. So, doing things like having either a formal or informal mentorship where you connect whatever type of behavioral health provider you are onboarding, have them have someone that is in a similar position. So this is going to be more like sort of a buddy that they can go to and ask questions, especially if it's someone who is not a seasoned provider and they just are coming out of their, they have just done all of their hours and they're a brand new LCSW or any provider, but especially those who are brand new to their profession and are new to practicing. Make sure that you are giving them the tools that they need to succeed in a mentor. I think that you will find that even if it's an informal thing where you just, connect the two providers together, it's really going to go a long way to the retention of that new provider. With that mentorship is obviously the connections with that mentor and also other providers, whether it be behavioral health or whether it's just on your medical side or even your dental side, really just connecting everybody, your new staffer with other members of staff in your onboarding process. And, weaving your mission and how you do things into that process and into your mentoring, your connections is really, really important. Also, some check-ins, whether it's a formal check-in or an informal check-in that your new provider's boss has with them. That is really going to be a crucial part of that onboarding process, figuring out exactly what's going well during that process, what's not going well, and what the new provider can be improving or focusing on during the next, whether it's in the next 6 months or next 90 days. That's a really crucial part of the onboarding process. So don't forget that. Don't forget, bring them in and do the first, couple weeks and, get them going and then just sort of forget to check in until their annual review. Because if you're checking in with them and you are making and tweaking and adjustments, making small adjustments as you go along, I think that you'll really find that the provider, your new provider, is going to be happier, and also your patients are going to be happier. So, so keep that in mind as you are doing the onboarding process, and putting that as is, you know, in your overall retention plan, because again, it's, you know, it seems like it's a little bit of a stretch, but it really isn't, because the onboarding process is going to be, you know, if your providers are not happy within the first, let's say, you know, 30 to 90 days of their employment, then, and, you know, you're not tweaking things and making adjustments, then they're probably not going to stay with you long term. So make sure you put that on your priority list when it comes to your overall retention process. Okay, so along with the onboarding process, and really starts in that onboarding process, you want to make sure that you are thinking about how you're engaging your providers, and how you are, you know, as relates to their, not only their job that they're doing for 40 hours or whatever, however long they're in your health center every week, but also outside of your four walls. So you're going to want to think about the type of volunteer opportunities that they can partake in, and as it relates to your overall health center mission, any community relationships that you guys have and that relate to your mission. So it might be some things that they could either volunteer in or have community relationships with. So whether it's other services, so it could be, you know, you're finding that a lot of your patients at your health center are lacking basic things such as, you know, as food and clothing. You know, connecting them with things like your local food bank or clothes closet are great things that, you know, obviously your missions are going to align, and those relationships are going to be really crucial to making, into helping your providers feel engaged and like they're really making a difference outside of what they're doing, you know, both what they're doing in with their own practice and also outside their practice. You want to think about also how maybe a sabbatical can also be a part of engaging your providers. If a sabbatical is going to be, you know, related to the mission, I spent some time doing direct recruitment at the Virginia PCA, and I talked to more people than I can count, you know, just thinking of right now, that doing mission work and doing volunteer mission work was important to them. So think about how perhaps a sabbatical could really be an advantage to, you know, be important to your providers, and how you can weave that into your overall retention plan there. Okay, so we're going to be moving down, and we're going to be talking about compensation and how that relates to as an element of your overall retention plan. And with your compensation strategy, we're going to be looking at work-life balance and how that affects things. It's definitely something that has become more and more important in the last several years. Finances, so that's really obviously what we think about usually when it comes to compensation, and also recreation as a part of your overall compensation strategy as it relates to retention. Okay, so work-life balance. As I mentioned in the last slide, it has become a buzz phrase of sorts in the last several years, and it's really gotten big in the last 5. It's something that whether, you know, you're a behavioral health provider or you're a medical provider or you are a dental provider, providers just want work-life balance. They want to feel like they can have a life outside of their work. It's very different than it was, you know, 25 years ago. And so if you've been in this this business and in HR a long time, it's definitely something that I know you've seen change. And if you're new to this, you know, if this is something that's kind of new to you, then, you know, it's just kind of part of the fabric of, you know, of being in HR and working with candidates and also retaining them. So some ideas that, you know, that we have as far as increasing folks' work-life balance and therefore increasing their retention because they feel like they're not going to be burned out so quickly, are some flexible hours. So, whether it is a job share or you end up just having a part-time, whether it's a part-time psychiatrist or an LCSW or whatever type of behavioral health provider we're talking about here, you might be able to offer them flexible hours. So again, part-time hours, job sharing, or, whether it's, they just want to work all mornings because they want to be able to get their children off the bus in the afternoon. Those are some things to definitely think about when you're thinking about your overall compensation and benefits package and plan in your retention plan. So flexible hours, limited call. This is something that, again, doesn't matter what your provider type is. It's definitely something that I can't tell you how many candidates I've talked to over the years that, that's not what they're interested in. It kind of, it really, if they have limited call, if they're only have a call one weekend a month or 2 weekends a month, it's really, one weekend every 2 months, that's really going to go a long way to increasing their work-life balance. And I know it can be tough to really figure out how you're going to do that, but I would encourage you to figure out how you can limit the call for your providers, because it's really going to decrease the burnout and therefore increasing retention. Another sort of kind of outside of the box thinking when it comes to compensation is childcare. So whether or not it's something that you can offer a subsidy for or a discount for, it's definitely something to think about when it comes to your overall compensation package, because as many folks do, they have children, and figuring out childcare is going to be part of that. So, really stretch your thinking when it comes to your compensation package and figure out how you can put some things in there that can enhance the work-life balance of your providers. Okay, so as we move from work-life balance to finances, again, this is kind of when we talk about the nitty-gritty of dollars and cents, it's going to be, what we think about more when it comes to overall traditional compensation plans. So some things to think about when it comes to the financial aspect are financial planning service. Is there something, do you have a bank, a local bank, or even a regional bank that offers financial planning for health center staff, or just overall, overall provider staff? So think about that. Especially when you have new providers, they're fresh out of training. They are not sure how to put a budget together for their own self, in their own lives. And so this can be really something that is going to be a great service to your providers, and they're definitely going to thank you for it. Also, mortgage assistance. If they're relocating to your community, they're probably going to be buying a home. So again, hooking them up with either a local or a regional bank that can provide them some mortgage assistance is going to be something that really goes a long way, not only in their overall compensation package, but just as just a part of that building that culture. Again, really having all of these services that you are providing to your providers as a part of your package, and it really goes a long way to making them feel valued and to really getting things off at a good foot and really making them feel part of the team. Another thing that you could think about offering some assistance with is transportation. And, if you live in an urban center and you have either some parking costs associated with your building or your area, or whether or not it's public transportation. So putting that into your overall compensation package is something that you can think about there, and could really be, again, it might only be, $20 a month, but it really is going to go a long way to be like, yeah, that's a great benefit that we have. And that's something that I didn't have at my former employer. So think about those things as you are putting your overall compensation package together. And the final thing that we're going to talk about today as it relates to compensation is recreation. So these are things that are, that are financial incentives, but they're not really as again, overall compensation package, especially if you have a breakout of your all of the things that make up that plan, but that fall outside of salary and traditional fringe benefits. So these could include concierge service. Do you have somebody in your local area that you can contract with to help your providers by running errands for them, or doing things that doing little small things that they can so they can focus on seeing patients and not worrying about all the things that they need to be doing outside of working hours. Also think about maybe some discounts, whether it is at a local recreation area, a state park, or some things like that. But think about some discounts that you can be offering your providers that are going to really enhance the quality of life and really feel like really get folks excited about. Vacation. It kind of goes without saying, but make sure that you are being competitive with the vacation or PTO that you're offering your providers. You want to be able to give them enough time, or they feel like they can take some time off, unplug, recharge, do some fun things, whether with their friends or their family, and really having whether it's if they're asking for an additional week off that you hadn't given or hadn't thought about giving folks as part of your overall compensation package, really take a look at that. Again, if you look at that financial impact tool and take a look at turnover, I bet you, I don't know what, that, a lot, that the cost of giving your providers an extra either few days of vacation or a week of vacation is going to be far less than what it costs to find another provider. So, if you're feeling like, if you're hearing from your providers that this is something that they really want more of, and that they don't feel like that they have enough vacation, obviously within reason, definitely think about putting it into your overall package and increasing that vacation. It is a simple benefit, but it is one that can really go a long way to retaining your employees. So definitely think about that. Okay. Time for another poll. Number 2. And this is when it comes to your overall compensation strategy. So does your compensation strategy include any non-traditional elements, such as things like work-life balance, discounts, etc.? Okay. Oh, excuse me. C, we are considering it, but we haven't implemented anything yet. I stopped reading and started paying attention to the answers coming in. I apologize. Okay, we're going to leave that open just for a few seconds. Give it about 2 or 3 more seconds to give you guys a chance to answer, and then we'll go ahead and close it. It looks like that, most of you, or 57% of you, say yes, that you are doing something of a sort of a non-traditional element in your compensation plan. 29% say that you are considering it, but you haven't implemented it yet. And 14% say no, that's not something that you guys do. We'll talk about this a little bit more at the end, and but just think about that, and think about either if you do, yes, think about the things that you do, and especially those who haven't done anything but are considering it. And for those that don't have any, I'm really interested to hear a little bit more from you as we go along at the end, and we talk about the discussion board and throughout this week. So thanks for sharing, you guys. Okay, so the next sort of rung on the ladder, if you will, is career paths. So when we think about career paths, we want to be thinking about, that really most people either they want to do something other than, what they want to have something, a goal. They want to really be reaching for something and, doing something to better themselves in their career, whether it's, another job within the organization or just really some training and some edifications in the job that they're doing. So we're going to be talking in this section about training, special projects, and also financial support that your health center can offer them. Okay, so training. So this is something that your providers have gotten a lot of in their schooling. It doesn't really matter the type of schooling that they have had. And when it comes to behavioral health, the schooling can look a little bit different. Whether it's you've got a psychiatrist, an LCSW, an LCP, whatever the path that they took to where the type of behavioral health provider, they are going to, again, they're going to be wanting to continue their training once they're on staff with you guys. So think about the types of the training that they might want or they might need, and make sure that your HR staff is up to date on the type of the training that they might want to further their education on, and make sure that they can provide some counseling and be a resource to them as they come to you and talk to you about this as a part of whether it's their recertification or keeping their licensure or things like that. So make sure that you have the resources to be able to counsel them through that. You could also consider bringing in some resources and some training on site. So whether it's a crisis intervention training that you have, or another type of training that could be relevant to your behavioral health team or your overall provider team or your overall staff as a whole, see if it's cost effective to bring it on site. If it's something that you need to have more than a couple providers or more than a couple providers want to partake in, it's definitely something to look into if you want to bring it on site. Also, offer training and things, especially if it's going to be on site, that's going to be relevant to the positions that they're in. A lot of times there could be something that is going to be relevant specifically to your behavioral health staff that your dental staff really isn't going to, isn't really going to need. So make sure that the things that you are offering them or are going to be relevant to their role. When it comes to special projects, there are really a lot of different ways that you can think about looking at special projects. Make sure that you are offering an opportunity for your providers to be networking with other providers. There are times where you really don't want your providers to feel isolated. And again, doesn't matter the type of staff that we're talking about, even though we're really focusing on behavioral health staff here, you want to give them an opportunity to network with their overall team within your health center, and also as a part of a network when it comes to local, regional, and national. Really, you want to be able them to be able to have an opportunity to network and to do things with other behavioral health staff in their same space. Another special project that you could also think about is, does this specific provider like to teach? It's something that I think that some of you might agree that a lot of people, it doesn't matter what their profession, they love to teach. When it comes to, do they want to precept? Do they want to, would they like to be a mentor? As I mentioned earlier, is it something that they want to sort of teach informally and have that mentorship role, or do they want to be a mentor and supervise, a new LCSW that's coming up that needs all those supervised hours? So think about that. If they really want to do that, figure out a way to let them do that, because it will really go a long way if they're feeling fulfilled in their professional role. It's really going to go a long way to helping you get those retention numbers up. And also research. Research could be another thing. Is there something specifically that they are interested in, whether it's something that they can integrate into their overall treatment of their patients, or whether it's something that they want to embark on in the community. So that's just another special project that they could work on, and really can, again, all of these things, and giving them special projects and making them feel valued and that their interests are important. It's something that can go a long way to helping retention at your health center. So we've talked a lot about all these things that the training and the support that you can provide, but with that, not only is the time important and giving them time to do those things, but offering the financial support. Most health centers, as a part of their compensation package, are offering tuition assistance, reimbursement, or time off for CEs and CMEs. Make sure that that's a part of your overall compensation plan, and also part of your career path, because it's really important for again, for that networking. If you're providing the financial support for them to be a part of their national association, it can go a long way with helping them feel like that they can get that camaraderie, that that soft place to land when it comes to those specific issues that they're going through as a behavioral health provider. Also, associations is another great one that you could offer financial support, as I mentioned earlier, and other resources. So are there resources that are specific to their space as a behavioral health provider that they would like, to provide either their patients, or they need, specifically here, that they need, resources that would make their life easier, and that they would enhance their job and their position in what they're doing there. So again, just some things to think about. There are other things that you could think about when it comes to their career path, but these are just some specific examples that we have here today. Okay, so we had talked about these four groups or elements of retention plans, and I would like to hear what, after this call today and after this webinar, what do you think that your health center would benefit from implementing most? So would it be the mission, focusing on the mission and how it relates to recruiting and engagement and all that, compensation and benefits, work schedules, whether it's part-time or job sharing or things of that nature, or career paths, or D, we need all the above? And we'll leave that open for just a few more seconds as you guys answered that. And this is kind of a tough one, but when in doubt, just say all the above, or just pick one that you think that maybe is something you've been thinking about at your health center and really feel like could help you guys. Okay, so we have 17% split evenly throughout A through D, and then 33% say that you guys need all the above. So, even though you're saying that you need all the above, which, I can completely understand, pick one thing that maybe you have heard the most about, and maybe whether or not you've done a survey or things like that about, employee satisfaction survey. If there's something that keeps sticking out, you might want to start with that. And if not, just pick one and start there, because obviously it's daunting to go through every single one of these. And the fastest way to do nothing is to be overwhelmed. So, again, just take one and focus on that, and, just get started. And I know you'll be glad you did. Okay. As we wrap up today, I want to talk a little bit more about the discussion board. And I know you guys are probably sick of me just talking about the discussion board today, But again, it's really going to enhance your overall experience. So please log on there. And again, if you don't know your login information, contact Mariah and she can get you hooked up and get you on there. And go ahead and log in, and you can download the slides and also listen to this. But also, you can engage with others. And that's really the most important part about the discussion board. All the faculty are monitoring the discussion board. And, again, whether or not you have like one sentence to add or a whole paragraph, it doesn't matter. Whatever you're going to contribute is going to be valuable. So please log on there and do that. And the discussion board questions are kind of wordy this week, but nonetheless, they will probably seem familiar to you because they are very similar to the poll questions this week. The first one is if you have a non-traditional compensation element that you find works well as a retention tool, what is it? And if you have one, please just put it in there and let us know why. And then if you don't, what's something that you want to try? Again, very similar to the poll question, but sort of an add-on to the poll question. And so go in there and just, again, there are no wrong answers. Just put whatever you think, or if you don't have something that's working well for you, just go ahead and put something in there. And I'm really excited to see some of the, if you have something non-traditional, I'm really excited to see what you guys have to offer there. The second discussion board question is what element, very similar to the last poll question, what element of a retention plan do you think your organization would benefit from most and why? And again, if you answered that you guys need all of the above, just pick the one that you feel like is really, you're really lacking the most, or you really need to work on the most there. So again, log on there, take some time. It only takes 5 minutes. I promise. It's not going to take all day to do that. And I always love what people say because and put on there, because especially when it comes to things like non-traditional compensation elements, there are things that I would have never thought about that people put on there, and it really will give you ideas, and it could be the thing that is going to keep your providers on board with you. So anyway, take some time, answer discussion board questions, talk to the other members of the cohort and see what they have to say. The fun part, questions. What do you guys have to ask me? And I am going to see if there are any questions there. And it looks like, didn't have much, but it looks like there were some things that some people had some audio difficulties, and I am so sorry for that. Hopefully it was resolved and you were able to hear me. And if there's something that you missed, guys, 3 of you who said that, feel free to go ahead and listen to the recording. If there is a specific part of the recording, you can, with YouTube, you can slide over to the part of the recording that you missed. So feel free to go ahead and listen to that. I don't think there are any other questions that came in, but again, I will say, there are some things, having and putting together a retention plan can seem daunting. And when it comes to all of these elements, don't feel like you need to, don't feel like you need to just do them all at once, because again, you don't want to get overwhelmed. So start small and go from there. If I had to pick one thing, if someone would ask me if I had to pick one thing that they wanted to start with compensation. It is a tangible thing that you can really get a grasp on. You can look at the data of, Allison talked a lot about data last week, and you can refer back to that and start with your compensation and figure out how your overall compensation package works. It's something that people think about most when it comes to your overall compensation package. So think about salary. That might be a great place to start there, and then work your way out. Okay, so if there are no other questions, we will look forward to our next time together, and that is going to be next week, same time, same place, same bat channel, and all that kind of good stuff. November 14th at 3 p.m. Eastern. And also, again, I know I've said it like 5 times today, but please do go on the discussion board, even if it's just to just do a quick answer and check it off your list for the week. Put it on your to-do list. I know you'll be glad you did, and we will go from that. So Mariah's put the discussion board login information there. Is again at the platforms tab at chworkforce.org, and feel free to email Mariah if you have any trouble logging on there. So thanks so much for joining us this week. We hope you guys had fun, and we look forward to talking to you next week. Y'all have a great week. Thanks so much.